Nigeria is set to have an $82 billion gap in healthcare delivery. This huge gap is not only in spending but also in access to healthcare, especially in the rural communities in Nigeria. In helping to bridge this gap, the National Association of Sea Dogs, a charity and humanitarian organization, takes medical outreach to a local community in Abuja. Our correspondent Moyo Thomas reports.
Economic recession and sharp impact of COVID-19 pandemic has further widened the healthcare delivery gap in Nigeria. Even with obvious symptoms, many people would prefer to try alternatives rather than see a doctor. One of such is Victoria Elaikura, a resident of Ushafa community in Abuja. She is at the primary healthcare today for a medical checkup, a routine she says she has not done in several years. But she is ready to take advantage of this medical outreach organized by the National Association of Sea Dogs in Nigeria to get a free checkup.
When you are coming for tests, you must have money. The drugs, you must have money to pay. So sometimes you weigh yourself and see, because I cannot come here free. I must buy drugs, I must pay for tests. So as I hear there's a free treatment here, so I use the opportunity to come.
Mrs. Elaikura is a 48-year-old mother of 4 who sells charcoal to make a living, a venture from which she makes a paltry sum of about 1,000 naira weekly. She tells me she feeds her family from this meager amount as her husband has been out of job for over 5 years. For her, only free medical checkups like this afford her an opportunity to get her vitals checked and blood work done or even see a doctor.
I have ulcer and I have BP, and sometimes my body will be weak, so I'm here so that they will check.
The community healthcare officer at the health center affirms that not many visit the center except usually on emergency.
We have emergency cases that will be rushed into the facility. Maybe they have been sick for a long time and they didn't come, maybe as a result of poverty also. So maybe when it is out of hand, they will not rush them to the facility.
Beyond the consultation, drugs and mosquito nets provided for the people, the intervention also made provision for referrals in dire cases. This is indeed a great opportunity for indigenes and residents of Ushafa community, as from young to old had an uncommon opportunity. Organizers say giving back and helping the people of the community is the motivation.
We have chosen Ushafa this quarter because I had actually had a distress call from the SU Ushafa. He mentioned to me that he's got this hearing problem and he needed help. So we organized the ENT to see him.
We actually want to bring healthcare delivery to the grassroots, where people are actually unable to access quality healthcare.
They said the intervention is also to mark the World Health Day.
Nigeria decided to join the rest of the world to mark World Health Day, and the theme, which is building a fairer and better world, was very apt, especially going through what we just came out from, COVID-19. And why the theme is so very apt is because of the huge gap we are experiencing in the world all over as far as health delivery systems is concerned, especially here in Nigeria.
Poverty hinders people from seeking health care, and experts are worried at gaps in healthcare delivery, which only further deepens poverty. With a huge gap in the healthcare delivery system in the country, efforts from individuals and charity organizations such as these will help bridge this gap. Moyo Thomas, TVC News, Abuja.